Good morning, friends. This is Dr. Shweta. Today I am going to make a video regarding MDMS versus DNB. This video will probably clear all your doubts. I have tried to cover all and each and every aspects regarding the various confusion and the course of DNB and regarding MDMS and its comparison. So beginning with first, as we all know, MDMS course is given by MCI and it's a 3 years course which we do after MBBS. DNB is a parallel course which full form is Diploma in National Board and is given by NB. So after MBBS, there are 2 to 3 paths which we can take after giving post-graduate examination. Either we can take MD or either we can take MD or MS according to our rank, which is 3 years course, or we can take DNB, which is also a 3 years course. At the end of DNB, we get a DNB degree, while at the end of MD, we get an MD degree. There is separate course also, which is diploma course, which is basically a 2 years course. After 2 years, we get a diploma degree, and then if you want, but this diploma degree is considered below than MD or DNB degree. So if you want equivalence to MD, MS or DNB, then we have to again give exam of secondary DNB, which is known as PDCET, Post Diploma Combined Entrance Test, and after that course of 2 years. So after diploma of 2 years, you have to give PDCT exam, which will be again of which will after clearing it, it will be again of 2 years. Then after total of 4 years of study duration, you will at the end of it you will get a degree which is again DNB degree, but the course duration will be of total 4 years. So today we will be talking about the comparison between MDMS versus DNB. There are various confusion regarding the same. First, let's talk about advantage of taking DNB. The first and the foremost important thing which helps in taking a DNB is that in DNB you can get subject of your choice. Suppose uh, your rank is above 10,000 or 15,000 and you are not getting MD medicine or MS surgery, but at the same rank you can get DNB degree of the same branch. So you will get subject of your choice. For the people who are very passionate about the branch, they can take DNB and can pursue the course further. Second advantage of DNB is that in MCI they have considered MD and DNB almost equivalent. So for NEET super specialty exam, either if you even if you did MD or DNB, both are considered equivalent. In almost all the notifications which come of the various jobs, they ask either MD, MS or DNB degree. So it is almost equivalent in the both the cases. The third advantage of the DNB is that there are few hospitals, there are certain hospitals which are very good, and they are very good for doing DNB. Like many government hospitals are also under DNB, like DDU or the Deen Dayal Upadhyay Hospital in Delhi, or their BR Medical Hospital, etc. So there is teaching as equivalent to MD or MS. And then the next advantage of the doing DNB is that uh, the in some subjects, like let us assume radiotherapy or in radio diagnosis, it is largely technology dependent branch, so almost all facilities are available in private hospital. So if you do DNB, then we will get exposed to the modern day facilities, etc. At many cases also, at many places in DNB there is no bond, so at the end of DNB you are free. uh, However, this trend has been changing in recent years, but for large cases, there is no bond post DNB. So, however, in the case of the MDMS, in maximum places of the country, there is bond which is present, which you have to serve depending on the place, which can range from 1 to 5 years, and so this is a problems. Next advantage of DNB, which I consider, is that they are private hospitals, so the accountability is more there. So you learn anything about according to protocol, and so you learn things more in a systematic way. These all are advantage of DNB. Now, what are the cons or what are the disadvantage of DNB? The first disadvantage which I consider in DNB is that in though many centers are very good, especially where there are government hospitals or railway hospitals, but there are many corporate hospitals also which are incorporated in DNB, and their patient exposure is less, relatively less, load is also less. The problem is that in government hospitals you get to look after all types of cases, various syndromes comes, various types of all variants of disease come, but in the private hospital only the people who can afford are going. So the only certain section of society go there, so the kind of disease exposure is less there. This is a truth. However, it depends on center to center, but for larger centers, for a large amount of hospitals, this holds true. Second important is freehand. Basically, a person learns most of his abilities or skills in the PG itself. But in the case of the DNB, there are many hospitals or corporate hospitals which hardly give you any free hand. Like you will not get any free hand in surgical branches, which is very important for your skill development. Basically, what happens is in the private hospitals, the cases comes with the name of the consultant. Let us assume the faculty of certain branch. Let us assume from MRI, neurology will send that this MRI has to be done by this doctor itself, or this NTNB scan or T5 scan has to be done by certain consultant itself in the radiology. So it will become difficult because you will not get cases, and so your hand will not be free. It's problem in DNB, especially it becomes a problem in surgical branches. Third and the most important part which is we discuss is that the passing percentage in the DNB hospitals or in DNB courses is still low. It has increased, but it is still low because especially in surgical branches like orthopedics, it is still very low. The problem is once you have to pass theory and practical exam separately. So once you fail in theory, then again you have to give theory again. And if in three consecutive theories you fail, then you have suppose you pass in one theory, then you will be able to give next practical. If in practical you fail, then you will again give next you can again give only next practical. But suppose you fail in consecutive three practicals, then you have to again repeat the cycle and pass the theory, and then followed by this you have to pass the practical. So however many people are passing, and there are certain various courses which have come, and people are doing well, but still it's difficult. I mean, uh, you can say ki, sir, what is the problem in it? I mean, it's better that we will be study more. That's right, but nobody wants to work extra. Everybody wants that it should be easy. Like in MDMS exam, it's very certain that almost all PGs pass. If even if they don't pass, then it is 100% certainty that they will pass in the supplementary exam. Moreover, the center is the same of the hospital. The cases are known, the juniors are known, so everything is known. But in the DNB exam, your center will go to other part of the country. Like if you are doing DNB from, let us assume, Odisha, then your center will go either in Delhi side. If you are doing DNB from, let's say, Jaipur, then also your center will go to Lucknow or other side. So it's difficult. Next part is that though MCI considered MD and DNB as equivalent, but there are certain lines which are, but there are certain criteria which are not making it equivalence. Like if you are doing DNB from a hospital less than 100 bedded, then you have to do 2 years of SRship to get equivalence to MD for the post of the next assistant professor post, sorry, SRC post. And if you have done in more than 500 bedded, then it's good. And the next part is that the social status of still DNB is not considered as par with MD. This is fact. You can deny it or not. I have no issues. But for normal people, MD is the real post graduation. DNB also post graduation, but people are knowing it. But for large amount of people, they say, matlab, the doubt about your degree. Ki, what is this DNB? And then you have to make them understand. This, sir, this is his degree. Obviously, once you pass and you get skill sets, then it hardly matters ki whether you are DNB or MD. But at this point of time, we only think about the present, not about what will going to happen in the future. Then academics part is good in most DNB and MD. In fact, is some at some point I think it's better in DNB. Now, then this is a general comparison between MD and DNB. But again, there are certain questions which generally people ask. First is First doubt is always about surgical branches. Eh, About surgical branches, I will always say that if you want to pursue DNB in surgery or orthopedics, or any other surgical branch, then please inquire about the college whether you get free hand or not. This is very important. Otherwise, if you get stuck in a private hospital, then you will most of the time you will spend more in preparing discharges, etc., and doing paperwork. So it will be advisable to first ask about the working condition, working hours, and whether you get free hand in surgical branches or not. Second, the question which generally people ask is, ki, sir, I am getting DNB in a very good institute. Say at my rank, I am getting DNB in a very good institute, uh, good for corporate hospital, and MD at a peripheral medical college. So what should I take? Though I might seem biased, but I will always say that take MD, because MD degree, because by taking MD, you will whatever you will not learn, let us assume in peripheral college, you can compensate in the SRCP itself, and there will be no pressure of passing the exam, etc. So I will always say that you take MD in peripheral institute rather than DNB in a very good institute of the same branch. Though this is your opinion, and it can depend on person to person. So, then next option is, sir, I am getting my choice DNB branch. Let us say, suppose I am getting, sir, DNB and DNB pediatrics and MD anesthesia, and I have always thought of being a pediatrician. So in this case, I will say that you took DNB pediatrics and prepare well, you will pass. Obviously, people are passing, but branch has not to be compromised. My saying is that now, if we if you consider everything, then overall my advice will be to, if it is your first attempt, then don't take DNB. Now many people will argue that, sir, there are people who are taking DNB at very good branches. I know that is truth, but such number are but such persons are very few. There are very few persons who are taking DNB at very good rank. So my advice will be, if this is your first attempt, then you better take, uh, and you are not getting MD subject of a choice, then don't take TNB. Rather, you prepare again. Even if your second choice, a second try, and if you think that you have prepared well, and still you are getting rank good enough for DNB only, then you can think of taking it. But never take DNB in the first attempt. Always try to for one or two more attempts and try to get MD or MS. It will be always better. So this was a whole comparison in which I think I have considered everything. Now many people will argue that, sir, what about MD in private hospital versus DNB? So that's a very separate topic, and it's very controversial topic, so I will not go into it. Similarly, many people say that, sir, there is a reservation also, so why not consider DNB? If you are getting DNB, people are getting reserve, people are getting seats at a far below rank, but that is also a separate issue. I will not talk about this, because this is a government plan. What this is a government plan, what they are doing, and we have no say in this. And whatever is happening, what we can only do, what is in our hand. Matlab, we can only think about the resources which have, with the seats which we have, and we have to make best of it. There is no point in fighting about useless things. So we have to only concentrate on the things which are in our hand. So this is a video. Thank you very much for watching.